Lafayette School. These school buildings will not reopen until the Milwaukee Health Department verifies that all lead safety standards have been met. As you know, 4 school buildings in our district that were previously closed have been reopened and are back in operations. I want to express my gratitude to the MPS crews and contractors and the entire team who have been working very, very hard around the clock and on weekends to do the necessary work to ensure these schools are safe for our students and our staff when they return. I also want to thank our families, our teachers, and our staff, and of course our students, for their patience, their advocacy, and their partnership as we work through this moment. This has not been easy on them, and we understand that. We're all committed to doing what we can do and doing everything we can do to get our students and our educators back in their buildings as quickly as possible, and as soon as they are safe to do so. As I look forward, I know that we are going to need a strong collaborative leadership model and team to address the complex nature of this issue before us. And that includes our facility department in order to lead this work. Today, I'm also announcing leadership changes in that department. Sean Kane, who has served as Senior Director of Facilities and Maintenance Services, will no longer serve in that role and is separating from the district. I want to thank him for his 25 years of service to our district. I will immediately begin a search for a permanent replacement to lead the district. In the interim, I am pleased to announce that 2 extraordinary leaders will help us lead our work in this area with the entire team already doing this incredible work. Mikhail Manin is the Director of Milwaukee Health Department's Home Environmental Health Division. He's going to step in to support us full-time. He brings more than 25 years of experience in code enforcement, lead risk assessment, and environmental hazard mitigation. He's certified in both lead and asbestos inspection and abatement, and previously served as lead risk assessor for 5 years with MHD. His role will focus on supporting lead hazard remediation, reviewing cleaning protocols, guiding routine inspections, and advising on the department's of MPS lead action plan. This strengthened collaboration reinforces the shared priority of safeguarding our students and our staff. In addition, I've asked Mike Terza to help lead our facilities department on a temporary basis. Mike Terza is a well-respected member of the Milwaukee community who served the district admirably until his retirement 9 years ago. As you will recall, I brought him on my transition team when I first started to help us with the governor's operational audit, and he's been overseeing the lead work since then. He will help us lead this department until a permanent replacement is found. I'm confident that the appointments I'm making today are in the best interest of our district, our staff, our students, and our families. We must move forward with a plan that everyone has confidence in, that everyone trusts, and that puts the health and well-being of our students and staff at the forefront. I was honored to be selected as superintendent of Milwaukee Public Schools because I see opportunities here, and I believe it is winnable for our students if we have a community-led and a community-driven process. I also know that for our students to succeed, they must be free to learn, grow, and thrive in buildings that they deserve, that are safe, healthy, and welcoming. That must be our baseline. Today brings us one step closer to that goal. I'm now glad to welcome Milwaukee Mayor Cavalier Johnson to the podium to offer some remarks, and then we'll be happy to answer your questions. And I also want to just thank you, Mayor, for taking my call and working with me closely. Thank you.
Thank you so much, Dr. Caselius. Dr. Caselius has been a phenomenal leader for Milwaukee Public Schools. I can recall her very first day on the job on March 15th. She arrived at our testing clinic down at Bradley Tech High School before I even did, checking with staff in MPS, checking with staff in the health department, checking with families and students who are impacted by lead hazards in our schools. There's nothing, absolutely nothing more important than the health and the well-being of kids in Milwaukee, and that's why you see this collaborative approach that's happening right now between the Milwaukee Public Schools, as well as the City of Milwaukee's Health Department. We recognize that there are issues, and we are actively working to address those issues with keeping the health and, again, the well-being of kids at the forefront. So I am so pleased and proud to work alongside Dr. Cassellius. I know my administration is as well. And to go into some additional details, I'm going to invite now the Commissioner of Health, Dr. Michael Todoritis.
Thank you, Mayor Johnson, and thank you, Dr. Cassellius, for this moment right now. As you know, back in January when we started this investigation into the Milwaukee Public Schools, it was growing in complexity. And at that time, we really started to see the level of degradation across the schools that we were in. We've took the extraordinary step of closing some of those schools and then continued to further assess those schools and test children as well through partnerships with Children's Wisconsin as well as our partners at 16th Street Community Health Center. This has been an evolving situation and really led us to this moment today where Dr. Cassellius is talking about the transition in leadership and our ability at the Milwaukee Health Department in the City of Milwaukee to lend one of our top experts to the district to help them move into the next chapter of this story. We're extremely grateful to Director Mannon for his expertise that he has brought to the department over the last couple of years, and he's been instrumental in rebuilding our lead program since our failures back in 2018. He is uniquely situated to walk MPS into this next era of stabilizing the buildings and ensuring that this doesn't happen again in 10 years or 15 years. We're extremely grateful for this moment and grateful that our team has been working tirelessly with the district to get to this moment. As I'm sure many are wondering about Director Kane's departure, you know, I never want to see anybody lose their job or their role. However, I do think at this moment it was warranted to help move us into this next step. As Dr. Cassellius outlined, she has taken other leadership positions to make sure that there is the right people in the interim as we move towards a safer set of schools and ensuring that the ongoing maintenance of these schools is happening. With that, I'm happy to take any questions from the
Why
group.
specifically was he fired? And was he fired, or is he still in some sort of position capacity within MPS?
Well, as you know, we can't talk to personnel matters, and so what I can assure the public is that we are working on behalf of the best interests of our students and our staff, and leadership changes were necessary at this time to ensure that we were able to deal with this complex nature of the issue before us.
How was he able to work for years without an architecture license that was valid?
I can't speak to what happened before, but I can speak to what we are going to be doing moving forward with our HR processes and our HR department in order to improve processes moving forward.
Whose decision was it to bring the city in to take his spot?
Well, you know, it is a mutual decision. I had called the mayor and asked for help. I'm used to mayoral control of schools, and, you know, I believe I said here that it's going to be a community-led, community-driven, collaborative process to turn around our schools and to address the needs within our schools, and that's going to take civic leadership, county leadership, state leadership, and leadership right here with our board and in our own teams.
Did John Kane's time in the position lead?
Go ahead.
Two questions. The first one, how many kids have been tested for lead poisoning since January, since all this started? And then the second question is, in terms of assessing lead levels in the school buildings themselves, like what parts of the schools are being tested and focused on?
Great question. So to answer your first question, the clinic that happened on Bradley Tech High School on the 15th, we screened 249 students and their siblings. I think initially we had reported 251. There was a couple duplicate records that we adjusted, so 249. And then there has been routine screening that's been happening in pediatricians' offices as well. I don't have that exact number since we started making that recommendation back in January. And then in terms of the schools and what's going on in the schools, we have pivoted from the testing of dust wipe samples across the schools inside the buildings that we're going into, where instead we're using a checklist and a visual inspection methodology that's outlined in state statute to ensure that we're quickly assessing the schools as opposed to doing the dust wipe samples, which usually take at least a week and a half to get processed. So that visual inspection is a little bit quicker and allows us to see really quickly the paint degradation and make a recommendation. In some cases, based on what we've learned from the other schools, we're using those pieces like sealing porous floors like tiles or concrete floors with some sort of sealant to prevent lead intrusion, and then making it easier to clean and keep the lead hazards down. We've learned those lessons and are working with the district on improving their cleaning protocols and sealing protocols so that they're able to do that preemptively before we get into additional schools.
Can you provide a timeline of when you reached out to the National Center for Environmental Health asking for assistance on this lead crisis, why you reached out to them, and now the consequences of those positions being terminated at the federal level will have on MPS?
Yeah, that's a great question. So back in January, the state of Wisconsin has an environmental section in their Division of Public Health. And within that section, they have actually what's called an Epidemiologic Intelligence Service Officer, or EIS officer. That is a CDC assignee. They're used in a lot of different capacities here in the state. They were assigned to our environmental section to help them. So in January, we, based on the recommendation of the state, reached out to the EIS officer to talk about getting connections to additional federal assets. So you mentioned the folks in the National Center for Environmental Health and their childhood lead prevention program. We were connected with those folks immediately to make that connection, share information. We shared what we were finding in the schools, and they were providing technical assistance on some of the medical toxicology, so helping us make sure that we were going to prioritize children correctly depending on their lead level as we saw that testing data come in. And then secondly, they were helping us validate our visual inspection work as well. So they were providing a lot of really good support. On the 25th or 26th of March, we actually put in a formal request, what's called an EPI-aid, to the CDC for additional staff to come to Milwaukee to help us with the mass screening plan here for the district. So we have already undergone that planning process and are continuing that planning process, but 2 days ago, I believe on Tuesday, we were notified that those staff were terminated, or RIFT, reduction in workforce, at the federal level, and are no longer employed by the CDC. That request that we proffered, though, the EPI-aid, was transferred to ASDR, which is another section that was under Health and Human Services for the federal government, and apologize, I don't have the exact spelling of the acronym. That unit is actually moving under CDC as part of the reorganization of HHS, so they acknowledged receipt of that request and are now evaluating if they can even send support to Milwaukee. In the interim, our partner here at DHS and the EIS officer that we're working with is committed to continuing to support us as we plan for additional testing.
Commissioner, I'd like to go back to January, Commissioner. Between you and the Deputy Commissioner and the Mayor's office, there were a series of emails in which the two of you had said to a staffer in his office, you were not allowed into the building on January 11th to do a full risk assessment at Golda Meir after you found out about the lead-poisoned student. Can you confirm that, first of all? And second of all, did that hinder progress for you in moving forward to actually assess the scope of this problem?
Yeah, so that from what, again, was reported to me at that time, that was what happened, that Director Kane did not allow us to go into the school and did not disclose that there was work that actually happened that weekend until the following Monday. So that delayed our entry into the school to do the full lead risk assessment, which was published on our website, and certainly delayed our ability to see other schools because we were primarily focusing on Golda Meir Lower Campus at the initial onset of this in January.
So when you found out that MPS was already doing its own lead remediation work without, it sounded like from those emails, without your approval in the process, what was your reaction to that?
I was frustrated. Our team was also ready to send a staff of, I think, about 8 individuals and lead risk assessors to go to the schools. We were ready to work that weekend. But really at this moment, we're really extremely grateful to the district and Dr. Casales' leadership to have us at this moment here, where we're able to bring in our expert and bring in additional support to the district to help them move into this next chapter of our story here.
As lead remediation continues, does MPS and MHD have a joint plan set up yet?
The plan was proffered on the 21st, as Dr. Casales mentioned. That draft is a good starting point. We provided some revisions, and we're optimistic that we should have that full plan released back out to the public for everyone to look at. It builds off of the annual maintenance plan that they had outlined, which I believe is also available publicly right now, and provided some edits to that. We're also making the suggestion to have more screening happening for the children in the rest of the schools as well, because that's the best way we can determine if children have been poisoned or not, is to do lead screening.
What is the timeline for reopening these three schools, and why has there been, I guess, these many weeks, even though there was spring break, right, where you can have days and days where no children are in the schools?
I don't know, Dr. Casellas, if you want to mention anything, or otherwise have it talk to you where we are, or Michael? Okay.
Going on in the schools.
Good morning, Michael Harris. Yes, so with the timeline for the schools, of course, we had spring break in there. We want to make sure that we are meeting the highest expectations for our students to return in those buildings. Our parents have made it loud and clear that they expect us to meet the guidelines that have been set forth by MHD, and we're excited to meet those expectations. Again, staffing is always a concern. Folks need time off, and we've been pushing a lot of our employees, and we're grateful for their tenacity to really work hard to get this work done. But we also realize that they need time for themselves to rejuvenate, to come back in. We want to make sure that we're doing this work correctly, and that's our focus right now.
So was work done over spring break, or were those employees off for that period too?
No, they were not off. We had some employees working during that time, and they continue to work today. So we are moving forward with all of that work. We've looked at hiring more painters to come in to support us in these efforts. Fernwood is a large school, and so we want to make sure that that is being ready and prepped for those students to return. We have that town hall coming up, so we want to just make sure that we're dotting our I's, crossing T's to ensure that all of our students and staff are returning back into those buildings in a safe environment.
Do you know how much it's cost about for remediation?
I don't have a cost readily available, but we could definitely provide that to you.
Speaking of that town hall, parents have voiced concerns over the fact that this town hall is going to be virtual with a limit of 90 seconds per person, requiring only a specific amount of parents to speak at this town hall. Why not offer an opportunity for parents to talk with you in person? More than 400 parents have signed letters to the district asking for Sean Kane to resign. So can you also, I understand you can't comment on personnel matters, but can you just ease parents' concerns that he is no longer with the district if that is the case?
Well, he will no longer be leading this lead work, and that is going to be led by the individuals that I said. It's a full team that is going to, and I feel fully confident on the team that will be leading it. So as for the Zoom that we have on April 10th, we have said that we needed that because it will give more access to parents actually. Parents can view it on their phone, they can have access to Zoom. There will be other meetings that we will offer for parents, but this is the first meeting that we wanted to offer for our schools that are impacted. So there will be other opportunities for them to ask questions, and we will also have an FAQ so that parents can go on our website, look and see where their questions are, and call in for those questions.
You said earlier that he is separating from the district, so is he or is he not still employed by MPS?
I cannot speak to the personnel matters at this time. What I can say is he's not leading this crisis, and we have installed a new team to be able to work with the lead abatement and mitigation.
Superintendent, or I should say, do you know how BSPS found out that his architect registration was expired?
So again, I'm not going to speak to personnel matters involving Sean Kane at this press conference today.
When you saw all the violations that came in, from the state last month, I'm sure you've seen those about lead mitigation work within MPS buildings, by MPS workers. What was your reaction to some of the more egregious ones?
So I have been reading a lot the past 3 weeks about our operations within the district. There is work that we need to do, and my reaction is that we need to get ready to do it and roll up our sleeves and use every resource, and I really am grateful to the city for helping us with this one.
I have a clarification for the Health Department on the Lafayette report that was released a few weeks ago. In that report, it said that there were signs of disturbed asbestos. We already have a lead crisis. Bringing the word asbestos in is really scary for parents. What is the health risk of finding possible asbestos in schools, and are you concerned that other schools contain asbestos as well?
So as the district has asbestos and lead in the schools, they also have a plan for asbestos. From what we were able to observe, and as we've mentioned before, we're working with the Environmental Protection Agency, or EPA, that do asbestos and lead investigations and making sure people are following those plans. EPA has not taken any enforcement activity, and for parents that don't know about asbestos, as long as it's not disturbed, that is the best course. A lot of homes in our city have asbestos in them, including my own, and observation of a damaged lining is something that I believe was noted in the La Follette report. We just make that note as part of our normal process, and I believe EPA observed it as well. In some cases, they might issue corrective orders. I don't think they have at this point, but they've been actively working with us and the Division of Public Health at the state of Wisconsin, because their section also does lead and asbestos as well. So, you know, we're being comprehensive with what's going on, and if there's needs to pivot students out of rooms that are hazardous, those requests would be made. And as we have at this point, the district has been really great working with us to make sure that students are safe.
The 3 schools that remain closed, is there any consideration of permanently shutting those down?
I can't speak to that. I don't have any comment on that.
No, the district did a facility study last year, and I have to take that under with the board and decide how to move forward with that. Thank you.
Is there going to be any further investigation into Sean Kane's potential oversight or missteps that led to where we are now?
Well, again, I'm not going to speak to matters of personnel matters at this time.
Michael, quick question. In terms of additional MPS schools, are we looking at any additional schools that might be further closed?
I mean, we've discussed previously that we're still looking with at the remaining schools with the district. So,
Thank you.
Thank you.
Thank you so much.
Thank you.